is Sharonda, and this TikTok I'm making for my daughter who is currently in a LPN program and asks for some assistance with a few chapters of hers. So we're going to start off, baby girl, with chapter 11, pain management. Pain is an unpleasant experience. It's private and it is usually associated with disease or injury. It also has an emotional component that is referred to as suffering. The American Association of Nurses states in their position statement that nurses have an ethical responsibility to relieve pain and the suffering that it causes. In essence, baby girl, your ability to control your patient's pain will set the tone for your workflow during your shift. Pain management is extremely important. About 60 to 75% of people over the age of 65 report persistent pain. This number is believed to be considerably higher when we take into consideration people that are living in assisted living and long-term care environments. About 20% take pain medicine several times a week for joint and muscle pain, lingering pain from previous injuries, cancer pain, and other types of chronic pain. Lack of adequate pain assessment can contribute to the undertreatment of pain in institutionalized adults, especially when their cultural backgrounds differ from their care providers. Remember, your geriatric patients or your older adults may be reluctant to report pain. They may think that this is a normal part of their aging process, and they also may fear that they will be labeled as difficult if they report their pain. Remember, your pain assessment must include nonverbal cues and body cues that conflict with verbal messages. Your patient is grimacing and saying that no, they're not in pain. That message would conflict with their body cues, with their non-verbal language. Your adults experience constipation due to decreased fluid intake, lack of mobility, or an adverse reaction to pain medication. Providing fluid, fiber, and stool softeners along with the pain medication can prevent long periods of time without bowel movements and possible fecal impactions. Older adults that receive pain medicine around the clock must have accurate assessment of their urine and bowel eliminations, and they also must have accurate documentation of their urine and bowel elimination patterns. Medication levels can dangerously increase due to prolonged absorption, metabolism, and prolonged elimination time. If your patient has a change in their level of consciousness, their awareness or awakeness, this may be an indicator that those medication levels may have increased within the resident's or the patient's body. Some people assume that pain sensitivity and perception decreases with age. This type of thinking can cause inaccurate assessments and inadequate control of the patient's pain. Inaccurate assessment of pain and undertreatment of pain can lead to unnecessary suffering for our geriatric patients. Some older adults may be reluctant to even report their pain, and they may describe their pain as burning or aching and stinging. Your cognitive impaired patients may not be able to report their pain. Your confused patients may not be able to report their pain. So in this situation, you're going to use your assessment of their behavior, their previous assessments of their behavior. You'll use report from other nurses in order to get an accurate assessment of this patient pain. You'll also use their body cues, their nonverbal language, to gather an accurate assessment on patients that are cognitively impaired or confused. Pain may manifest as agitation, aggression, withdrawal, changes in their behavior patterns, changes in their position, their body positioning, as well as changes even in their sleep pattern. Remember, the patient may use distracting techniques to manage their pain, like watching TV or reading a book. This does not mean that this client or this person is not in pain. Pain is the number one complaint of older Americans who take analgesics regularly. And what are analgesics? They are simply pain medicines. They tend to split their doses, or they may skip their doses, our older population or our geriatric population, to try to save on the expense of buying their pain medications. Constipation is a side effect of opioid use in our geriatric patients. So whenever a geriatric patient is started on a pain medicine or an opiate, a bowel regimen must be in place to help prevent them from becoming constipated. When the older adult is taking multiple pain medications for chronic and acute diseases, this can increase their susceptibility to drug reactions and drug interactions. Older adults that are taking non-steroidal anti-inflammatory drugs or NSAIDs are at increased risk for gastric ulcers and renal toxicity or problems with their kidneys. Analgesics given intramuscularly to the older adult are less effective because of the decreased muscle mass that they have. Some older adults are reluctant to even take pain medication due to their fear of becoming addicted. This is when our nursing education is in to help provide the education that the patient needs in order to help us assist them to alleviate their pain and suffering.